Sunshine State over the U.S. Supreme Court ruling on health care. Florida Governor Rick Scott saying that his state will continue to fight it. Attorney General Pam Bondi appeared on America's Newsroom last Friday with some reasons why. Take a listen.
We still believe it's unconstitutional. It is such an overreach by the federal government. You know, we have a federalist society, and our founding fathers firmly believed that states should have the right to do what we feel is best for our individual state. And that's the biggest fear of this opinion. It's fraught with peril.
We are pleased to have Governor Rick Scott here in our New York studio. Welcome to New York.
Nice to be here. Attorney General Bondi has done a wonderful job. It's very disappointing what the Supreme Court did. This is going to be devastating for patients.
Well, explain to me first why Florida would opt out of Medicaid expansion, since the federal government, at least in the early years, is going to pay 100% of it.
You just said it, in the early years. But on top of that, it's not free. I mean, it's $1.9 billion a year. Right. You're still paying it. I mean, the Florida taxpayers are paying federal taxes. On top of that, they're only going to cover all of it in the first 3 years. Then Florida taxpayers are going to be on the hook.
Yeah, but for only what, 10%?
But eventually we'll be on the hook for 45% of it. So it never look. Government healthcare programs everywhere in the world do three things. They promise you the world. They say, "Oh, we're going to cover everything." Then what they do is they run out of money and they underpay hospitals, doctors, and guess what happens? They don't want to take care of you. There's fewer of them, just like what's happened in England and Canada, places like that. So your care, if you care about patients, this is devastating for you.
But what happens, Governor, to the thousands of folks who will fall under that mandatory expansion of Medicaid up to 133% of the poverty level?
You know, we already have a very good kids care program. We already have a very good Medicaid program that covers up some individuals up to 133% of poverty. Look, if you want to fix the system and you actually want to make sure people get health care, then you use the free market. Make sure individuals know what things cost. Make sure providers, there's more competition, which drives down price. If you care about pre-existing condition, give you the same tax breaks as an employer so you own your own policy, so you don't lose it when you change jobs. And reward people for not smoking, for exercising, for eating right. You do those things, the cost of healthcare will come down. That's our problem.
Are you telling me that if Florida opts out, which is what you're saying you're going to do on the Medicaid expansion, people nevertheless, all people in Florida will still be able to get health care?
Well, you know, the whole focus is that I'm focused on getting them jobs. That's how they get health care.
But I'm talking about some folks who get sick. They will get health care. Everybody in Florida.
Look, you get health care today. All right, you can buy healthcare insurance. What this is actually going to do is it's going to be more difficult to get actual healthcare. Insurance is not the answer. It's drive down the cost of healthcare. You have insurance in countries like UK and Canada where they say, "Oh, we cover you," but you don't get it because it's rationed. That's what's going to happen.
You're also intending to opt out of the insurance mandate, or excuse me, the building of insurance exchanges. Why?
They don't work. If it was such a great idea, the private sector would do it. And we know the Congressional Budget Office said if you're going to buy your own policy with these exchanges, you'll be paying 10% more. A family will. So about $2,100 more for a family. So you're going to pay more with these exchanges. They don't work. Government involvement in healthcare has only caused healthcare costs to go up, and it's rationing care. It's devastating for patients.
Let me switch subjects on you. You have been trying to clean up the voter registration rolls in the state of Florida, and you've been in a big battle with the Attorney General, Eric Holder, over this.
This is shocking.
And Holder went to court seeking an injunction. You won.
We won last week. I mean, look, this is not a partisan issue. Republicans, Democrats, Independents all agree non-U.S. citizens don't get to vote in our races. And guess what we found out? We started looking at it, and we have found non-U.S. citizens registered to vote and voting in our elections. So we've been asking for the federal database that we have a right to. It's Department of Homeland Security.
They still won't give it to you.
They still haven't given it to us. The justice came and tried to get an injunction against us. We won last week. The judge says it would be irreparable harm for us not to clean up our voter rolls.
So what's your next move? I mean, you're still not getting the database.
We're going to decide this week what the next step is, because we've got to get that, because I want fair, honest elections. I don't know anyone that doesn't.
Holder says you're suppressing votes.